So first of all, I want to talk about the indications for a pessary trial. So number one, they have a need for a pessary, right? They either have pelvic organ prolapse, or they have urinary incontinence, or the patient has both issues. The patient has symptoms of usually her prolapse or incontinence and has a desire for a non-surgical intervention. There's maybe medical contraindications to surgery, such as comorbidities, age, health issues that would make surgery kind of a risky option for them. So we opt for a vaginal support device instead. And then last, they desire to postpone their surgery. And I've had this over the 20 years that I worked at a urogyn clinic. They would say, oh, I definitely want my surgery, but I'm going on a cruise in a month, so I don't want to be post-op, so let me get through this cruise and I'll come back and schedule surgery. So we would fit, or I would fit with a pessary to postpone that, or a wedding, etc. So sometimes they want that surgical intervention, but they don't want it right then. So what are the contraindications to a pessary? And I'm not going to say they're absolute contraindications, because a lot of times if we fix the problem, we can move towards that vaginal support device option for most of our patients. So first of all, an active local infection. If they have a vaginal infection, we want to treat that, yeast infection or whatever, and then have them come back and have them participate in that pessary trial. If they have latex allergies, there's only one pessary that is a latex type pessary that's made by one company, and there are several companies that provide vaginal support devices for us, and they do have the inflatable now that is not necessarily latex, so there is an alternate option to latex sensitive patients. But know that there is one particular pessary, it's an inflatable type pessary that is latex made, that is out there. All the other pessaries are silicone, and what's great about silicone is there's a less propensity for it to cause odor, and it's easy to mold and insert for the most part. Another contraindication is possibly non-compliance with follow-up. So, sometimes we end up fitting a vaginal support device or a pessary in patients that have dementia or memory issues. And if we're concerned that they're not going to show back up for a follow-up, then, that might not be an option for them. However, a lot of times they have family members that will be in charge of their transportation and appointments, and we can work with them. But as you know, the long-term complication with a retained pessary is possible fistula formation. So you kind of want to not lose your pessary patients to follow-up if at all possible. And then, of course, sexually active women who are unable to insert and remove their pessary, that may not be an option for them unless their significant other is willing to assist with the insertion and removal for them. So those are some of the contraindications. As far as types of pessaries, we have kind of three main types. Number one is a space-occupying pessary, and this is in patients that I would say, have an intact introital opening, but a capacious vaginal vault, so to speak. The second is support pessaries, where you have an intact, maybe not even an intact introital opening. You may even have a gaping introital opening, and you have prolapse protruding out. So there are pessaries for that particular issue, because really if the introital opening is not intact, some of the support pessaries are not going to stay in, they're going to fall out. So you want to have an intact for certain types of pessaries, and I'll kind of show you that as we look at some of the pictures. And then, of course, incontinence pessaries. Some are just for incontinence, and some are made for incontinence and for pelvic organ prolapse. So I'm sure most of this is a review for y'all, but I wanted to start here. So these are 3 companies that provide pessary supplies for us as practitioners, nurses that care for patients with pelvic organ prolapse or urinary incontinence. And I've used all of these companies and their products, and they're all, some companies offer pessaries that other companies do not. So if your facility only orders from one company, at least go online and see what pessaries these other companies offer, because what you may be, like we used one particular company in my clinic for, that was who we ordered from. However, sometimes I couldn't find a pessary from that company that would work, but when I looked at the other companies, they had an alternative. So I just wanted to just open your mind up to different companies, different pessaries. And of course, this is a box. This is courtesy of MedGYN, and all of the companies will supply you with a pessary box if you are willing to purchase it. And they come with a variety of pessaries. In my clinic, what we had was we actually purchased the pessaries, and I had a fitting kit, and I had my own little rolling box and drawers, and I had my pessaries in these drawers. And when I had a pessary fitting, I would take my pessary cart into the room with me, and my fitting kit, I would fit them, and then I would actually place that pessary in and go from there. So, but sometimes, in practices, our practice isn't going to afford that. So you have to kind of guesstimate, and it's all a guesstimation anyway, and then fit and, do your fitting trial, which I'm going to, go over how to fit, and then order the right pessary, have them come back. Usually when I did it that way, I would actually order a couple of sizes just in case the size I thought might work actually didn't work. I'd have an alternate there as well. So keep that in mind. So the first pessary, which is really the easiest one to talk about, is the incontinence pessaries. They come either with a diaphragm to help with pelvic organ prolapse and urinary incontinence, or they come without a diaphragm, which is just basically a ring with a knob. And the way it works actually is the knob is in front, and so when the patient coughs, sneezes, laughs, jumps around, that knob actually pushes up on the urethra and kind of occludes it. So it's a mechanical way to occlude the urethra when they're with abdominal pressure, and it prevents leakage, hopefully, right? And then, of course, the Marland here is that third pessary. I'm going to practice using this. That's mainly for prolapse. However, it is indicated for incontinence as well. So I wanted you to know about that pessary because most of my career I fit with these others, and it wasn't towards the end of my career that I realized there were other devices out there. So this is the hard part, predicting the best pessary choice for our particular patient that's in front of us that day.